sure what you're talking about. So I'd have to, you have to give me some more clarification. Yes, sir.
Governor, Regeneron not only effective against COVID-19, like you said, helping to prevent the president of your team. You've been out in the state promoting it. Have you done enough to promote vaccination?
Well, you tell me. I mean, how many events I did? I've done over 50 public events. I was in Broward as soon as we got the Pfizer, we were the first state in the nursing home. I literally wheeled one of the seniors out after having done it. We brought vaccines and were criticized for doing it to places like Century Village in Broward, Kings Point and Delray Beach. We were bringing it directly into senior communities. We brought it into retail pharmacies and were criticized for making it easier for people to be able to get the vaccination. So I would encourage you to go rewind the tape and watch what had happened over those times and how relentless we were about saying seniors first. Everybody's going to be able to get it. And sure enough, as Dr. Shepke said, since April, every single adult Floridian has had easy access to this. This has been distributed far and wide. You've been able to do it. But as Dr. Shepke said, it's not an either or. But if you're facing infection, which many Floridians have with this Delta wave, then what do you do? And I think the data is very clear. The vaccines are helping to prevent severe illness amongst people who do it. But once you're infected, the vaccine is not going to treat the infection. And so what do you need to do to be able to do that? So it's obviously both. But when you look at having almost 4 million seniors vaccinated, and we're #1 in the Southeast in our region, and we're ahead of the national average on that, we're not doing mandates because, quite frankly, I don't know individuals' health. It's their decision. And I remember going to that when we went to the first nursing home. We went there, and it was very emotional for a lot of the residents because they had had a rough 9 months with how fragile nursing homes were, and obviously the residents were very high risk. You had some that were crying, and they were so happy, but you know what? There were some residents who just did not want to take it. And so who am I to say an 85-year-old, I don't know their health conditions, I don't know what's bringing them that. They may have had a prior COVID infection. And so there was never a desire to mandate this on anybody, but I can tell you this, vaccinated or not, if you come down with this, we want to make sure you have an opportunity to go get treated. We want you to be able to neutralize the infection, and I can tell you, clinically the data is strong, and then what we've seen in Florida has been really strong. And my thing is like, okay, put the politics aside, recognize what, I think almost every physician has said this is positive if you're taking it appropriately. Even the Biden administration, they're all in on this. They've been promoting it. You know, you don't see the same type of little, games being played in terms of them, but I could do the same thing if you wanted to do that. But that's just what happens. That's just the world we live in. So that's been the case. So let's get this done, because the number of people who have been admitted to hospitals would have been dramatically less if they had known that this was something they should have solved early. Look, some of it's just human nature. You get infected, maybe you feel okay, maybe not that bad, modest symptoms. You kind of hope, well, I'm not going to get that sick, right? And maybe that's the case. But if you're in one of these high-risk groups, just know that you have the ability to bring some serious ammunition to the fight here with these antibodies, and especially those folks in those high-risk categories. They're the ones that are less likely to produce the right immune response. And so this is providing, really, it's turbocharging their immune system and the antibodies that are able to respond. So it's been very, very effective. Now more and more people know about it, and I just hope that the message is put out very, very clearly and accurately. This is free to every Floridian who qualifies and wants to avail themselves of it. It's free to the state of Florida. That's just the reality, and it's something that, if done early, will absolutely stand a great chance of keeping you out of the hospital. It also can be used, incidentally, not just to treat a COVID infection, but actually it's been approved for emergency use for vulnerable people to use as a prophylaxis. So, for example, if you have an infection at a nursing home, you can then have, our teams can go in and they can provide the treatment to the nursing home residents even if they have not tested positive. And so it's being both in terms of the additional treatment but also as a prophylaxis. It's approved for both of those things, And I think that that's very important. So what you're going to see what you're seeing now with the nursing home strike teams, there's an issue in the nursing homes. You know, we have been able to go in and we're able to give this and offer this to folks. And again, this will be, our vulnerable population is overwhelmingly vaccinated, and you're still seeing positive cases. And so it will be applied either way, regardless of that status, and particularly if you're in a vulnerable category. So they will be going into nursing homes. They'll be able to offer this. You can do it both IV, but you can also do sub-Q, which is much quicker and allows you to do more. You go in a nursing home and knock that out very quick if you're doing the sub-Q. Only Regeneron is approved for sub-Q application. The other ones all require only IV. Regeneron, you could do IV or you could do sub-Q, which makes it much more versatile in doing it. So you're going to see us going into there, and you're also going to see, you may see up to 20 sites, by the end of this week. And I think it's going to make a big difference. What I can say is this: if you're in these high-risk groups and you're following, and as soon as you develop symptoms, if you come do this, you will absolutely see over the next couple weeks a decline in hospital admissions. And at the end of the day, if somebody gets infected and they have a mild illness for a day or two and they recover, we'd much rather see that than obviously see them hospitalized. And I think this is really one of the keys. Not the only key, because there's so many more things to be able to do. But at the end of the day, when you have a lot of infections, this is something where people need to turn to. Okay, thanks so much. We'll see you guys soon.